Hello, and welcome to this edition of Oncology Data Advisors coverage of the Oncology Nursing Society ONS Congress 2025. Today we are here with Jeri Lowman, who is a nurse educator at the University of Colorado Hospital, about their presentation on aromatherapy to decrease nurse stress levels. So thank you so much for being with us today, Ms. Lowman, to talk about your presentation from ONS this year. Would you like to begin with introducing yourself and what you do?
My name's Jeri Lowman. I've been a nurse for 20 years and I've worked all of those years in oncology. So I was an infusion nurse working with blood disorders patients, so malignant hematology, general hematology, when I started this poster. Right now, I'm a clinical nurse educator for our cellular therapy program.
Terrific. We're so excited to have you today to talk more about this poster you presented. So, to begin, would you like to provide a brief overview of the poster and presentation that you did?
Yeah, we had some data from a organizational survey that indicated a lot of oncology nurses were feeling that the organization didn't support their health and well-being is where it really started from. We wanted to do some interventions that we could do, so we started looking at some options that would have low impact to patients and sort of focus on the nurses themselves. So what we wanted to see was the impact of lavender aromatherapy on reducing stress levels in the outpatient oncology infusion center. So we know that oncology nursing is not easy. These nurses are faced with a lot of stress and burnout and compassion fatigue. So we thought that maybe wearing lavender during their shift might be able to help them have less stress during their shift. So we decided to do a 2 week project where we did pre and post shift stress levels. With no, the first week was no intervention, and the second week we had the nurses wear an alcohol aromatherapy patch, which is just a little sticker on that you can put on your shirt, and it doesn't really interfere with patient care. And we weren't expecting to make that much of a difference, but we actually, when we looked at our data, the average post-shift stress level dropped from an average of 4.2 to 2.5, so it was almost a 40% decrease in nurses' perceived stress levels when they wore the lavender during their shifts. So it was easy to use, easy to implement. Like I said, it didn't really interfere with patient care. So we decided to tackle health and well-being with little pieces that we could.
Could you go more into kind of what was the genesis of the study? How did you decide on aromatherapy and how that would help oncology nurses?
Yeah, I guess it started when we met the representatives from the company that makes the product. The Eloquel reps were at ONS Congress. We met with them 2 years ago, and then we met with them again last year, and we were really in this phase where nurses weren't feeling like health and well-being was supported. And there's been a lot of data, a lot of studies done with aromatherapy in patients, and we know that it can reduce stress in patients, reduce their nausea. So we thought, why not try it with nurses? So we didn't go into this trying to get some really deep dive into stress and what stress means to people. We were more going into it with kind of a mindset of a quality improvement project rather than really digging into the research side of it. Our tool was pretty simple for measurement, so the kind of going into it, we really weren't expecting anything out of it. Honestly, we just thought, hey, we have this, we can offer this to nurses, and maybe they'll think that they'll have a different opinion of the organization caring about their health and well-being, but we got actually really good data. So
Was there any feedback that the nurses gave you regarding the aromatherapy and how it helped or hindered them?
Yeah, at the beginning of the study, some of the nurses said it was too strong. So instead of ripping the plastic all the way off, they would just rip it open a little bit because it was kind of strong being right here on your shirt and your chest. So um, a couple people said they felt like it maybe gave them a headache. A couple other nurses just said it made them sleepy, so they took it off. But I guess maybe they were relaxed and sleepy. But yeah, so those were the a little bit of a headache and the scent being too strong were really the feedback we got towards the beginning. But
Awesome. And are there any plans to continue this study or even expand studying aromatherapy in other areas of oncology, maybe for physicians or patients?
yeah, I'd really like to take this to a larger group of nurses as well. But maybe in like other areas we know that are high stress, like an emergency room or maybe an ICU or some. It would be interesting to get some data on what their stress levels are perceived like before and after in those situations where they're really um, in stressful situations taking care of patients. I would love to do that. I haven't really thought about different aromatherapy. Um, when I was looking at research, there has been some studies done where they would use maybe diffusers at nurses' stations, but um, that just creates a lot of variables of how much um, are they around the device, how much um, essential oils are they even exposed to. So this product seemed like a perfect product for what we were trying to achieve.
To conclude, are there any take home messages or further information you would like to share about aromatherapy or about oncology nursing in general?
Yeah, nursing in general, since the pandemic, it's been tough. um, I think a lot of organizations realize that nurses do have a lot of stress. They still feel, even after it's been 5 years, that they need to focus more on their health and well being to avoid burnout. So I think that organizations are going to start offering employees more options or kind of pushing that forward to bring their employees the resources that they need to continue the work. It's important work. It can lead to burnout, and you just have to take care of yourself as a nurse and be willing to do that for yourself.
Thank you so much for your research and caring about the nurses and their well being and their stress levels. And thank you for being.
Yeah. Thank you for asking me to come on.